drugs and their effects on the mind and body. Here's a breakdown of major drug categories and how they affect people mentally and physically. First, let's explore stimulants. These substances accelerate the body's systems. Cocaine and crack cocaine flood the brain with dopamine, creating intense euphoria. They increase heart rate, blood pressure, and body temperature. The high is short-lived. This leads to crashes, cravings, and compulsive use. Long-term use causes paranoia and cardiovascular damage. Methamphetamine massively overloads dopamine and serotonin systems, producing extreme energy and confidence. Long-term use destroys dopamine receptors, causing severe depression and memory loss. It can also cause psychosis, hallucinations, and severe dental decay, known as meth mouth. Adderall and prescription stimulants are designed to help focus when used medically. When misused, they cause a racing heart, anxiety, and insomnia. Dependency can develop quickly. Next, we examine depressants, which slow down the central nervous system. Alcohol slows the central nervous system, lowering inhibitions and impairing judgment. Long-term heavy use damages the liver, brain, and heart. It's one of the most dangerous to withdraw from. Benzodiazepines like Xanax calm the nervous system by enhancing GABA, a relaxing brain chemical. They are highly addictive, even when prescribed. Withdrawal can be life-threatening. Often mixed with opioids, they dramatically increase overdose risk. GHB is a CNS depressant often used as a club drug. Low doses cause euphoria and relaxation. Higher doses cause unconsciousness and respiratory failure. The margin between a high and a fatal dose is extremely narrow. Now let's discuss opioids, powerful pain relievers with high addiction potential. Heroin, fentanyl, and prescription painkillers bind to opioid receptors, blocking pain and flooding dopamine. They create intense warmth, relaxation, and euphoria. They are highly addictive. The brain rapidly stops producing natural endorphins. Overdose causes breathing to slow and stop. Fentanyl is 50 to 100 times stronger than morphine. A tiny amount can be fatal. Next, we explore psychedelics and hallucinogens, which alter perception. LSD disrupts serotonin signaling, causing vivid hallucinations and distorted perception. It's not physically addictive, but can cause terrifying bad trips and flashbacks that persist. Psilocybin or magic mushrooms are similar to LSD, but generally shorter lasting. They are being studied medically for depression and PTSD, but can cause intense psychological distress. PCP, or angel dust, causes dissociation, hallucinations, and extreme strength or aggression. It can make people unresponsive to pain, with a high risk of violent behavior and psychosis. Moving on to cannabis, specifically marijuana and THC. It binds to cannabinoid receptors, affecting mood, memory, and perception. It can cause relaxation, euphoria, and increased appetite. Heavy long-term use is linked to memory issues. High THC products can trigger anxiety, paranoia, and in rare cases, psychosis. CBD, a non-psychoactive component, is being studied for anxiety and pain relief. Next, we have dissociatives, which create a sense of detachment from reality. Ketamine blocks glutamate receptors, causing a dreamlike dissociative state. Medically, it's an anesthetic and approved for treatment-resistant depression. Recreational abuse can cause K-holes, complete dissociation from reality. Long-term abuse severely damages the bladder. Finally, empathogens, like MDMA or ecstasy, flood serotonin, dopamine, and norepinephrine. This creates intense feelings of love, empathy, and connection. The aftermath, or come down, causes severe depression as serotonin is depleted. Repeated heavy use can cause long-term serotonin system damage. It's being studied for PTSD. Now for some key takeaways about addiction. Most drugs hijack the brain's reward system, making natural pleasures feel dull by comparison. Tolerance means the brain adapts, requiring more of the drug to feel the same effect. Withdrawal can range from uncomfortable to life-threatening, depending on the substance. Polysubstance use, mixing drugs, especially depressants, multiplies overdose risk dramatically. Drugs can permanently worsen or trigger latent psychological conditions.